Welcome to NATF Spotlight. We are joined by Dr. Christopher Kabhrel of Massachusetts General Hospital and lead author of a study concerning inactivity in women and its influence on pulmonary embolism. Thank you for joining us.
Thank you for having me.
So, what is the importance of this study?
Well, as we know, pulmonary embolism is both a common and a deadly diagnosis, and we have been looking for years to find potential mechanisms and also opportunities for primary prevention of the disease. One area of interest has been exercise, although results up until now have been inconsistent. We have found in some studies that exercise decreases your risk of pulmonary embolism, but other authors have found that exercise might actually increase your risk of pulmonary embolism. We hypothesized that it may be that exercise as a variable does not fully categorize a person's activity level. And in fact, it may be the extent to which people have become sedentary in their lifestyle that is contributing to the increased incidence of pulmonary embolism. We therefore did this study using data from the Nurses' Health Study, a large cohort, and we looked at nearly 70,000 nurses. What we found was that the nurses who spent more time sitting per day had an increased risk of pulmonary embolism. We categorized nurses according to the amount of time they spent sitting each day, and we found that nurses in the highest level of sitting had more than twice the risk of pulmonary embolism than those who sat the least. We therefore think that time sitting, or sedentary lifestyle in general, is a significant risk factor for the development of pulmonary embolism. Now, this is the first study that has ever found this, and so we wanted to tease it out a little bit more as well. We looked in a sub-analysis at physical activity, and in fact found that exercise or physical activity was not associated with an increased risk of pulmonary embolism. Furthermore, we looked at the association between sedentary lifestyle, physical inactivity, in subjects who also got some exercise during the day. We speculated that maybe even a small amount of exercise could counteract the effect of having a largely sedentary lifestyle. In fact, we did find that subjects who had brief periods of exercise, despite a largely sedentary lifestyle, did have a decreased risk of pulmonary embolism compared to those who were sedentary without exercising at all.
How do you feel this will impact clinicians and other members of NATF?
Well, I think it depends on what your main focus is. Obviously, we think this is an important study, and it's the first study that looked at the relationship between physical inactivity and PE. Therefore, if you're a researcher, hopefully this will open up new avenues for research into the mechanism of pulmonary embolism and the pathophysiology of the disease. If you're a clinician and part of your role is counseling patients about risk modification and potential lifestyle factors that they can adjust in order to reduce their risk of PE, then perhaps counseling patients about getting up, moving around, and spending less of their lifetime sedentary, then perhaps that can be helpful to you as well. And lastly, for patients who are looking for ways to live healthier lifestyles and modify the risks of a variety of cardiovascular diseases, including PE, then knowing that simply getting up and walking around and spending less time sitting can reduce the risk of a potentially fatal illness may provide that little extra bit of motivation that makes you an overall healthier person.
Thank you, Dr. Kabhrel. This was NATF Spotlight, and we will be having more pulmonary embolism and deep vein thrombosis news for you shortly.
Thanks for having me.